Hey, thanks for joining, family. I'm well overdue for this. I've been too much of a perfectionist, as it were, trying to make videos, and just straight talking to people is going to be the easiest way to get going on this, so here it is. So I'm going to be talking about a topic that is controversial. Admittedly, I have been silencing myself, censoring myself, per my school's wishes, the university that I'm attending. Medical school will not entirely like what I'm about to say here, but it really is not an option anymore. I've got to talk about this stuff. And so, long and short, I'm going to talk today. This topic in this video is going to be why your medical provider, why your doctor cannot provide you the option of informed consent when it comes to vaccines. There's a very simple reason why your doctor can't give you the option, I should say, of informed consent. And I'll get to that real quickly, but this is a topic that's near and dear to my heart. I have children. I want to be a doctor. I want to be someone who's trusted to help other people attain their health and to maintain their health of the people they love and themselves. And so I take this really seriously, and I think that's probably why I've been so reticent and hesitant in bringing forth information, because I want to make sure I'm right. I value your health, and I want to make sure I know what I'm doing. So I'm a decade into studying health, and I still have not put out even a quarter of the material that I ought to be sharing with people. To that effect, on the vaccines, when it comes to this topic, the reason your doctor can't help you and give you full informed consent is because they don't know everything about vaccines. They're not taught it, so they can't give you the option. Informed consent is essentially me as a doctor giving my patient all they need so that they can make a decision for themselves. Without giving all they need to make an informed decision and consent to the treatment, they're not actively participating in this medical procedure. They're just trusting. This is a paternalistic paradigm that is then created, where the doctor dictates to the patient what's best for them, without the patient knowing fully what's going on. I want no part in that. I want to be on equal par with my client or with my patients. When I become a doctor, I want to make sure my patients have full informed consent. And so the short answer of why your doctor can't give you full informed consent on vaccines is because they're not taught it at all. I know this now, having been in medical school. They're not shown this stuff. Thanks for joining, everybody. Glad to see you here. If you have any questions, feel free to put them into the comments. Does this apply to all pharmaceuticals? Not entirely. Doctors are given some information on what's going into a pharmaceutical and some side effects, but very rarely are they given the full scope. When it comes to vaccines, they are not given even the ingredients. Most people will know more of what's in their salad dressing at the store. They'll turn around and check out the ingredients, but they don't even ask their doctor, what's in this shot you're about to give to my child or about to give to me. And so I'm kind of at the point where it's kicked me out in medical school for questioning the paradigm. I don't mind. Questioning is supposed to be part of a scientific process, and so I'm going to be coming full force in describing the questions and concerns I have as it relates to vaccinations. Again, this is not covered in medical school in any way, because they're just treating it as if vaccines work 100% of the time. They're treating it like vaccines are all the same across the board. If anyone calls you anti-vaxxer, they're oversimplifying the discussion. Vaccines are not the same. Each one has a little different background and ingredient list, and they ought to be treated as such and considered as such. I will talk about the topic in general, but I want to talk about what I'm really seeing going on here. And thankfully, the osteopathic medical school I'm going to, I'll give them a kudos on this point. Medical school, in this regard, can give the doctor a perspective that the body heals itself. And this is the point that I want to hone in on and tie back into vaccinations, because it's a very confusing thing to be in medical school right now. You hear one thing, it's a truth, and then you hear another thing, and it's like, that doesn't add up. I don't know if anyone's keeping track of this stuff, but with the coronavirus discussion and the vaccine discussion, it's not adding up. Anyone who's got a scientifically critical mind about this will say a lot of this stuff isn't adding up. So the body heals itself. It has a self-healing mechanism. That is something that's taught in osteopathic schools. Thank goodness. like I said, it seems like they forget it, because everything they do then and teach is about circumventing the body's intelligence and self-healing mechanism to try to force the body or subdue the body through the use of poisons or surgical operations. Very rarely do they look at an inflamed organ and go, maybe it's overworked, maybe it's overly toxified, maybe it's an abused organ. No, it's just the organ is malfunctioning, get it out of there. It reminds me honestly of when I was growing up I was raised in Catholic church. So growing up in Christian school, I read the Bible. I was that person who would read it and then try to apply it to people and situations and find it's not adding up. They would say things like, Jesus is within you. And then, well, we can't wait for the return of Jesus. I thought he was within me. Where is it? God is within you. He's within everything. God's within you all the time. Heaven's within you. And then you hear lines like from the preacher, you go to heaven if you're a good boy. I'm confused. I thought I was here already. So when it comes to medical practice and health practice, which should almost be separate, because I'm finding in medical school they don't get a lot of teaching about health, and they don't even exude that capacity. That most of the doctors I'm seeing aren't healthy. So I get why people like Staggs here are saying he doesn't trust the vaccines. There's a lot of things that aren't being given to us in full confidence and full discretion. So what I grew up with seeing in Catholic Church and the indiscrepancies of actually reading the material, I'm seeing again with COVID and coronavirus discussion. I'm doing my due diligence. I read the source material. I am reading the research articles, and then I'm getting told very strong opinions by people who have done very little research or very little investigation on this matter. In medical school, I don't recall hearing anything that the medical industry cures. They talk about cures, searching for cures, but I don't really hear a whole lot of curing discussion happening in medical school. They don't even cure acne, but I really don't hear discussion about curing cancer or curing heart disease or even something as easy as diabetes, because in my world it's kind of bizarre, because I've seen many people heal from incurable conditions. I've seen people get rid of their diabetic medications in 2 weeks, even though they were type 2 diabetic for a decade. So what am I to trust? Who are we to trust? Am I to trust my own experience and the beautiful healing power and the awesome intelligence of the body and God, Allah, life, great spirit that allows this body to function? Or should I trust supplying nourishing foods for my mind, body, and soul, along with the removal of toxins? Should I trust that? Or should I trust man's interpretation because I'm unworthy or incapable of understanding health myself? Is that what we should do? Should we trust man's ability to cure conditions for which he seems to not really understand the cause even? You want to trust man's ability to cure with supplying toxins? That's the model you want to trust? In the form of pharmaceutical drugs, vaccines, or maybe just trust the mask and neglect taking care of mind and body at all. I mean, by that logic, you can be overweight, out of shape, eat processed foods all day, every day, avoid human contact, drink, smoke, avoid sunshine, fresh air, and still be safe if you just wear the mask. I'm sorry, but this is just, it's confusing, because the doc that started the school that I'm at, the osteopathic schools, A.T. Still, he studied and observed the indigenous population and their health model. And he noticed that the body, given proper conditions, will heal itself, and given improper conditions, will degrade. And we just had this great doc on who's graduated, but she came back. She happens to be a bariatric surgeon, and she's discussing the gut microbiome and the fact that if you abuse this gut system, if you eat wrong foods, then the body essentially opens up little holes, little passages. So from gum to bum, there's a tube, and it's supposed to be squeezing and pulling out delicious food and turning it into fantastic functioning body parts. But if that that tube is compromised through the foods we're putting into it, we abuse it, then what gets through is not always what's supposed to get through. That becomes kind of a primary entry point for foreign matter. But I have this question, so I'm looking down my notes here for this. So knowing that these facts about the gut microbiome, I'm trying to keep up some of the questions here as well. If we think about what the U.S. eating pattern is, and it's obvious that one couldn't expect their gut linings to be tight and intact given the amount of McDonald's, the amount of fast foods you see, the amount of processed food aisles that we see constantly being consumed, there's no way we can assume that the entire U.S. population has a healthy gut lining. So if we know that it's not intact, therefore they're more susceptible to infections of all types. And if that's what we call, if that's what we can even call it at that point, it reminds me of another kind of analogy. If I'm driving my car and I'm dragging the gas tank along the highway, and it's scraping up, it's getting all scraped up, and then it opens up because I'm just dragging it so long and abusing it. It drags up, it opens up, and a piece of what should be the gas container breaks off. The metal part breaks off and flies in to what should be functioning car and starts to cause problems. Should I turn around and blame that little broken piece of the fuel tank? Or should I blame the conditions that I ran the car in, the way I held the body? And so we mistreat the body and then are surprised when things go wrong, and then we want to blame the little thing that shows up doing its normal functioning job. The doctor who was explaining the gut microbiome made the fantastic, true point that we depend on bacteria, we depend on viruses for communication, for transmission of information throughout the body, to build up and to break down materials. And then sometimes they can go awry and something that's normally there and benign, necessary, becomes a problem. I'm confused at where that line is as far as it becomes a problem, and why don't we just recognize the fact that we live in communion with a whole host of symbiotic microorganisms. As she pointed out again, and I've mentioned before, there's so many viruses that you couldn't even come close to documenting them or naming them. Trillions upon trillions, and they're constantly changing form. We're constantly producing them from our own healthy body as well as communicating modules. And so how we keep the body, how we keep the car is the more important thing, rather than the tiny little things that we're interacting with. More or less, if we remove the cause, then the symptoms are removed. For almost all cases of health, that seems to be the model that works best, rather than trying to force it in through a toxin or trying to force the body into recognizing something prematurely, which might be the vaccine model. If you keep your body in good health, if you keep the body in good condition, it is going to respond properly to things it interacts with. That goes for small microorganisms as well. Hence, we see most people responding quite fine to interacting with what's being termed the SARS-CoV-2 virus. So that's where if I was going to put my eggs in any basket and depend on anything, I'm going to depend on that natural ability of the body. I'm going to depend on supplying all that the body requires for health, and recognizing that, quite honestly, health is the natural state of the body if given the proper conditions. And if we're not getting the proper result, which the U.S. population is not getting, they should be way healthier given the amount of money that they spend on this attempt at being healthy. But you can't force it when you haven't removed the cause. I can't be abusing my thumb every day, no matter what I treat it with. If I'm hitting with a hammer every day, it's just going to get worse. No matter what type of treatment you come in with, there's no cure for constantly abusing something besides stopping the constant abuse. So I hope the U.S. population starts to take note of the fact that you're not getting any better. You're not going to reverse any conditions, whether it be heart disease, diabetes, or cancer, which are way more important, or not important, but just way more, if we're just shocking pure numbers, because personally I find every single death to be a tragedy, and every single any premature death could be a tragedy. So we're all looking for great health, but the U.S. population seems to be way off on their focus here. I got a couple questions. How can we use health science that justifies the natural ability of the body to stay healthy against science potentially enforcing vaccines? I would say the idea of forcing medical procedures on people should be nothing discussed within a free society. Clearly, if this is being discussed, that's not a free population that's discussing such. That said, so personally, I'm not going to be tested on in any manner of way. The reason I'm actually coming out with discussing this matter is because the school is talking about opening back up, which to me, they should have been opening up the entire time, because I have not seen any good reason why we should have been changing behavior patterns at all as a society, quite honestly, in response to this. And so the way they wanted me to mask up, I have not worn a mask, nor will I obstruct my breathing for any reason without good reasoning. And I have not seen a good reason to do so with this as the excuse. I have worn I wore it out in the summer when I was sawing some wood because I didn't want to get particulates. But as far as for this alleged virus issue, no, I would not do such a thing, and I'm not going to obstruct my breathing for multiple hours in any way, shape, or form for that. And so that question about if you had to get a vaccine, if someone ran up and stuck me in the arm and I couldn't deny it and get rid of it, the best thing you could do would be what you would do encountering any potential toxin or any potential toxin or pathogen in the world, would be take the best care of yourself beforehand. If you encounter the situation in good condition, that's the best chance you have, with the highest amount of vitality you have, to maintain homeostasis, maintain the level of health you have. We all deserve fantastic, vibrant health, and to me, it's an individual freedom to choose how you want to accomplish that goal. I really appreciate you taking the time to listen to my little opinion here on this matter. If you have any questions on this, I'd like to keep doing these dialogues. Maybe you've seen some of my recent posts. I'm realizing that, as I mentioned at the outset of this, I'm not going to censor myself when I'm participating actively with good intention to communicate health science to other people. And so I'm going to keep speaking on this matter, and I look forward to your feedback on it. My thoughts on the lockdowns. Yeah, I'd like to keep going on this time, so feel free to open up questions. My thoughts on the lockdowns are, if you support the lockdowns, I think you either don't care about poor people, or you don't care about old people, or you are really, 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 really bad at math. One of those three, you choose. But when you shut down society, the socioeconomic impact is on the poor people. Simple as that. Someone's saying you will take the shot. No, I won't take the shot. So lockdowns, for one, I have not seen any scientific research based upon lockdowns being an effective measure for mitigating a pathogenic infection or a pandemic. Two, I've not seen the pandemic level of deaths, quite honestly. No one, within that calculation of deaths, no one has still, even at the medical school, given me a definition of how I discern someone dying from COVID as to someone dying with COVID. How do I know if it's the comorbidities or if it's the COVID? Because there's no good science on, or research on, showing the introduction of the supposed SARS-CoV-2 virus and then boom, the animal turns out sick. I'm not supportive of animal testing, but I'm just saying they don't care about that, and they still haven't been able to prove that. So I'm not in any way convinced, I'm not in any way sure, and I don't know how anyone else could be so, that this virus is inherently causing the condition. Again, I want to make very clear, I'm not denying people have a condition that we can call COVID-19. I'm curious about how they get to that condition and what the real underlying cause of it is, because it surely hasn't been proven to be a virus, and surely we know that, just as I mentioned before with the gut lining, the U.S. population does not take care of themselves in any way, and so I don't understand how we would ever expect them to never test positive for some type of infection which again, I'm coming to the fourth point. The lockdowns were justified on what? With what? With what basis are you doing the testing? Well, then what's the gold standard for the testing? Because we didn't just discover a virus and completely isolate it and get the genetic material from it. You have a small bit of genetic material, small bit of RNA sequence that you're looking for, and in PCR testing, depending on how many cycles, I'm maybe getting too in the weeds here, but in PCR testing, depending on how many cycles you put that PCR test through, you can essentially get anything to match. Feel free to check out the inventor of PCR testing, Dr. Kerry Mullis. Make it very clear that using PCR testing for determining whether something is present in someone else's bloodstream is a horrible idea. It's a great PCR is a fantastic way to produce more genetic material, but as far as a diagnostic tool, it's not a great tool. The antibody testing, again, hardly accurate. Feel free to just ask a few questions of what's the false positive rate. Even with, I've done it on my blog, so feel free to go check this out. But I will check out the questions that were above here. I'm just going to try to answer this one entirely. But the lockdowns are based upon very, 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 very bad math. They're based upon projections of what could be. They're based upon testing results. And if you keep upping the test, guess what? You're going to get more positive tests. Is that more cases? Is that more deaths? No. But you get more positive tests. Again, the deaths aren't even close to on par with the amount of tests. As you see the tests go up, you're not seeing the deaths continuing that spike in any way. So the science is really, really bad. And I'm finding out that even within the small circle of the medical school, the scientific discussion is not to be had, which to me is not scientific, and it should be concerning to anyone who has an ethical bone in their body about why aren't we allowed to ask questions? Why can't I get your source material about where you're making your decisions from? Why are we not having an open discussion on this? So I'm going to check out some more questions here. Yeah, thank you. The truth will come out. I mean, there's a lot of doctors, even at the school, who hold a different opinion, but they're being silenced. They're not allowed to talk that, or they're scared to talk it. I made the decision recently that you can kick me out of medical school. I don't care anymore, because I'm getting frustrated with not being able to do my real work, which was helping people, connecting with people. I'm being put up in this office by myself studying medical school, which I could do on my own. And I came for the hands-on techniques. I came for the scientific discussion. I came for the growth, and I'm not getting what I wanted. And so, yeah, I'm going to take a huge hit financially, but I'll get it back because I'm going to focus back on making a contribution and providing value to the community, that I already have wanted to do. Yeah, I really do want to become a doctor. I still am going to pursue it and get those skills and get the trust of the society so I can perform at that level, yet not at the cost of my ethics, not at the cost of being able to speak freely about things. And so, yeah, it is what it is. I know I can do it. I'm glad. I kind of wanted to become a doctor just because I wanted to be able to critique it from an even part, to say, you know what? Because I came in having read some counter books. I came in having helped people, and so I kind of had a perspective already. But I wanted to give it a fresh set of eyes, and I wish I was more impressed. I'm very impressed with some of the doctors I've seen, but as far as the overall model that's happening, no. What about the mRNA notion of the vaccine? I'm not sure what that question was, VVV. If you want to explain that a little bit more. Can everyone be vegan from a medical perspective? From a medical perspective, it's interesting because medically we're studying, if I look at my Atlas of Human Anatomy, or if I grab my physiology book, there's not two books. There's just one physiology book. There's just one anatomy book. So they mean to assume that our digestive tract are so similar that, hey, we can just assume that one will do, and it'll be the model for everybody. Similarly, like we have a model for whales or a model for chimpanzees. And so it seems to me that if we have the same physiology, then we can make use of the same foods and have the same requirements. So it seems like nothing within the medical world discounts the ability for people to be vegan, and thankfully it's actually been championed a lot that people need to be eating a lot more plant-based foods to have better health. So from my perspective, it seems like veganism perfectly fits the bill, and I haven't seen anything within medical literature that discounts that. I haven't seen a single mention of the need for animal protein yet. Alright, so V's asking about this vaccine is not a dead virus being injected, but injection will alter DNA, making it something you wouldn't be able to detox from if you had side effects. You know, if this virus was never isolated, why are we still identifying the cause of COVID? So, about the actual, so I've checked out a couple of the vaccine models about this, but at the same time, and I have seen the technology is supposedly different than previous models of, as you mentioned, different vaccines where we have dead viruses in them, if you will, attenuated viruses. But my concern is that, as I think it was Darlico just pointed out, if the virus was never isolated, why are we still identifying it as the cause of COVID? That's kind of where I'm at. I'm still stuck on that. They want to skip right past Koch's postulate. They want to get to what are called Bradford Hill criteria, which are but some of the easiest criteria apparently to make a cause for. Because medical world, again, contradiction will say, oh, it's so complicated. We can never say that, cigarettes cause cancer. We can never say that, one thing causes something because there's so many things at play. And yet, when it comes to infectious disease, they love to go, boom, wholesale, that causes it. Even though sometimes you can have the symptoms without the actual supposed virus, like people have all the symptoms of COVID-19 without a positive test, without the SARS-CoV-2 virus in there. So it doesn't really add up to me as far as that goes. And as far as taking any type of vaccine for an unproven concept, no thank you. Not at all. Especially when the survival rate is so fantastic, no thank you. Especially when I can take care of myself and know that I'm not even considered we're looking at normal people getting these results of 99.9 survival rate. What about people who actually take care of themselves and actually focus on that? I have no concern about, in general, I'm gonna jump out the gate here and say this. I'm not concerned about viruses in general for myself. Bacteria and viruses aren't concerning to me. If I have an open wound, I'll concern myself with that, and I'll try to take care of that. But I don't have any openings into my body, and I'm not going to make a false opening into my body. God, Allah, the Creator, life, gave me a fully functioning human organism that is designed to protect itself and try to keep itself within and try to preserve itself for as long as it can. And there are layers here. Things go in through the mucus lining here, and there's layers of protection. I'm not going to bypass them and go straight into my bloodstream. No thank you. There's many layers of immune function that are supposed to interact, and no matter what the particle is, that are supposed to happen at a natural level in here, and I'd much rather take that as my vaccination or inoculation than skipping that into my bloodstream. No thank you. And I have not seen any evidence to convince me of that, and I've looked for it, by the way, because I'm not someone who's just sitting here with vaccine. I don't have all my books here, but I'm in my office right now, but I can show you. I've got vaccine books. So I went on Amazon. I searched out the top 10 pro-vaccine books, and I got those. And I've read them alongside with my other anti-vaccine books, and I'm telling you, I would never want to debate pro-vaccine. I would rather be on the questioning vaccine side. I'm about to do anti-vax. I'd much rather be on the questioning vaccine side than on trying to prove that vaccines work and are safe and effective and necessary. Did they make me get a flu shot before I started medical school? Yeah, this is why I'm probably not supposed to be making these videos like this. I am in a behind-the-scenes discussion on such because, again, I saw no reason to do such. So no, I would not take one. I've got a doctor, thankfully, who I almost want to give him a shout-out because you should check out his site. I almost want to check out I'm gonna shout these doctors out. Dr. Lavella, she was the one. Dr. Lavella, Erica Lavella. She is a bariatric surgeon, but is a fantastic. She has some great videos on her site about the gut microbiome and on how to maintain it and why it's relevant to mental health, to physical health on every level. And the other doctor that's writing me a flu vaccine exemption form, or signing my exemption, is Dr. Maybe I shouldn't be doing this. I shouldn't do this just yet. But I'm grateful to see that there's some doctors out there who have questioned this, who actually want to get good results with their patients. I shouldn't say that, because all the other doctors want to get good results. I don't want to put that out there. They really do. But I'm questioning how they get there, and I'm concerned at why they have such hostility to other forms of scientific health practices. Daralico, by the way, I'm sorry if I'm saying that wrong, but not all osteopathic medical schools will behave in the way that mine currently is. So I would stay optimistic there. I worked in hospital kitchens and acquired exemptions for vaccines. Way to go, Regenerate. Glad to see that. Again, in a free society, and we should be encouraging people to make their own informed decision. If vaccines are so great, don't force it on me. Educate me. Educate me. If it's so great, educate me, and I'll be convinced. I don't understand the problem. If it's such an easy concept, if it's so true, give me the proof, give me the reason, and I'll take it. I have no counter incentive or interest, no conflict of interest at all. I want my children to be healthy. I want myself to be healthy. I've told you on this channel before, if I somehow found out that eating meat was necessary, I would do it. I would give my children meat. I haven't seen the reasoning to do such. If I ever saw that vaccines were necessary, we're getting vaccines tomorrow, because I want to take care of my health. That's my only interest. I don't lose anything from taking a vaccine if I thought it was good. I don't gain anything from avoiding the vaccine if I thought it was good. So I don't understand where people assume of others, but I assume when a parent is questioning vaccines that parent is legitimately questioning it for the interest of their child. So to that effect, I think we should be encouraging people to make their own decisions. And if vaccines work so well, then, if someone doesn't want to take it, like myself or somebody else, cool, because you took it and vaccines work for you, so you're safe. So I'm confused on multiple levels as to why people think they need to force others into medical procedures. And so, and especially force them into medical procedures that they're not going to give you the full ability to make an informed decision about, because they're not going to tell you what's in the vaccine. That is, to me, unconscionable. I would never want to perform as a doctor like that. And so I hope that when you go to see your doctor, you ask him, what's in this shot you're about to give me? And I hope he can give you, or she can give you, a full description of what's in the shot, what are the contraindications, what could happen if you took the shot, and what could happen if you didn't take the shot, and what other options do you have. If they just come at you like, this is what you got to do because this is what's good for you, you're not working with someone who respects you. You're working with someone who thinks they're better than you and thinks they should tell you what to do. I don't want any part in that. I want medical practice to get back to being a humble, respectful participant in this fantastic life that is happening, because, as we mentioned before, it's God, Allah, life, Great Spirit, call what you want, but you can't force it. If you want to get better, if you want to heal, and we all deserve fantastic levels of health, happiness, success. If you want to heal, you have to work with this intelligence. You cannot force it. You can only prove the laws of nature. You can't break them. Thanks, Dr. Graham. You have to work with this body. And so as a doctor, the only thing I see a doctor being able to do, or myself being able to do when I become a doctor, is to intelligently help that body work towards healing. Which means maybe I can do a little bit of manipulations to free some space up. Maybe I can move some lymph around. Maybe I can do a little bit of that. But as far as what I can do from the outside of an acute situation, because I do want to give the props to mainstream medical for acute situations, emergency situations. But as far as what I can do for chronic illness and long-term mental health and things like that, there's not a whole lot I can do besides give you the tools, give you the knowledge, and give you the support for you to then do it yourself. Health is a participatory job. Healing comes from within, and it's high time that the medical profession get back to being humbled by the fantastic miracle of life and respect that and work with it rather than pretending like they have some higher perspective than life itself. It's heady stuff, and it's to me it's disgraceful when they the paternalistic aspect of medicine is disgraceful when they're not allowing patients to make the decisions. So can you use the qualifications as a doctor to navigate around big pharma to advocate raw food, nutrition, and lifestyle prescriptions to patients? That's my plan. The plan is that I hope to use the public's trust of doctoring to actually educate the public, let them in on the secret that, hey, guess what? If you want health, it's easy. It's actually easy if you just know how to do it. It's actually easier if the actual medical profession, which I hope to be as I'm going to do as a doctor, if the medical profession would make it easier. As you said, if we started prescribing healthy food as a model, as there are setups that are happening like this across the country where people are actually being prescribed by their doctor healthy food rather than a prescription. And so I want doctors out on the ground teaching people how to live healthfully. I want to have dinner with doc. I want people coming over to my house once a month or to my facility, and I can teach you how to eat healthfully. So we can, because for me, I had to pay, and I don't mind it at all. I feel it was the best investment I ever made. Was I invested to become an intern down in Costa Rica with some people who understood health, with a doctor who understood health. It cost me $5,000. That was the best investment I ever made. So I want people, and I had to see it. That's why I went, because I had to see it and feel it, what health was, how it looked, how to do it. And so the medical profession and the health profession should be out there teaching. The word doctor comes from docere, Latin for teach, to teach. So I do hope to be able to use my qualifications to affect that change. Can you say this live? I'd love to hear it. Can I say this live? I will save it, yeah. And thanks for following, yeah. Would you take non-vegan patients? Of course. Who refuse to go, yeah. It won't sorry for the connection. It won't entirely confuse me if a patient doesn't want to go vegan. I get it. But again, just like with the vaccine thing, I don't need to force you to go vegan. I got the truth on my side, at least from my perspective, from where I see it. I can just let you know. And I think if you know the full truth, you'll make the decision that best serves you. And if you don't want to go fully vegan, okay, that's on you. But I'm pretty sure I got some information that once you see it, you might want to consider it. And so I'll totally take patients wherever they're at. And my goal is not to put myself, as a doctor, I want to humble myself as a servant, as a companion, as a partner. I'm not above you. I don't want to be above you in any way or make you do something that you don't want to do. But I'd love to inform you about things that could better your life, that could let you experience a happier time on this planet. And so that's my perspective. I'm going to give you a bunch of information, help you out as best I can, but I'm not looking to pull you or force you in any way. I'm your friend. I'm your partner. You come to me because I'm the expert in understanding health, understanding human physiology, and helping you achieve your health goals. But you decide where you want to go, and you decide how to get there. So I'm losing connection here. Thanks for answering my question. I saw you on YouTube and emailed you confirming the flu shot. Okay. So all of you considering going to medical school, I appreciate, I've been getting questions from that in emails. Let me answer this question with how I would answer my child if they asked to go to medical school. My son comes up to me and said, "Dad, you think I should go to medical school?" I say, "Well, what do you want to do that for? What do you want?" Because, and he says to, if he turns and says to me, "Well, Dad, I want to help people become healthy, and so I want to understand health, and I want to understand how to help people get as healthy as they can possibly be." Then I would tell him, "Shoot, don't go there. Don't, because that's just not what they specialize in. They specialize in repairing people and symptom management, but they do not specialize in health. You could not go to your medical doctor unless he decided to train himself or herself outside of it. If they did, you can't go to him and say, excuse me, doc, I'm feeling fantastic. I'm feeling fantastic. How can I feel better? What can I do? Look at my lifestyle. What am I doing? What can I do to feel even better? They don't know. They're not skilled in that. They're not skilled in that. And they even admit things that they should just be ashamed about, quite honestly. So in the psychology block, we were learning about human psychology, which, let's not get into how little they know, or we know. Yet, therefore, we should be humbled and conservative in our approach. But they're talking about the things that are biggest stresses in someone's life. Psychological stressors. Number one, it has a score of like a scale of 100 to 0, and 100 is something that's just devastating to your life. So it was loss of a spouse, a long-term spouse, and death of a spouse, and marriage. Those were the two up top. And guess what they put medical school at? They put medical school up there. They put medical school on par with the death of a loved one. That's how stressful the situation is. So it's built to be stressful. It's built so you don't have enough time for yourself, or enough time for your loved ones, or enough time to critically analyze the material or investigate it. There's no time for that. I mean, if you do, which I do, it cuts into your memorization time, because at the end of the day, you're going to get tested on what you memorized for the exam. And so, no, it doesn't, I don't see it priding itself on scientific inquiry. I don't see it priding itself on health, actually living healthfully, the doctors themselves, the students, the capacity for students to be living healthfully. And then when I see the results going into the mainstream medical world, they don't have it unless so many of the doctors I respect, they might be an MD, they might be a DO, but they turn around and say like how much effort they had to put in themselves learning the material. So how much time they had to study on nutrition, because you may have heard this is true though, there will not be one question about human nutrition outside of the physiology of, say, how carbohydrates are utilized within the body, but there won't be any question about nutrition, human nutrition, or dietetics on any board exam. So your medical doctor does not get trained in nutrition unless the medical school, thankfully mine is, but unless the medical school has chosen to actually put some type of effort into providing some type of nutrition. But at the end of the day, not a lot of people are studying it too hard because they're not going to get tested on it. So the doctors coming out, I would never assume that they have any type of knowledge on nutrition. So, long and short, if my son asked that question, I would say, why do you need that title? Because that's the only reason I'm there in many ways, is because I need the title to do certain things in the world, and I want the hands-on osteopathic skills. I hope by the time my son is old enough to go to medical school, if he wants to, or become a doctor, that I provided some type of outlet, some type of healthier training mechanism for actually creating health practitioners in the world. What causes Alzheimer's? What do I think about naturopathic medicine? How old am I? Where am I from? Well, that's an interesting question, but I might be getting off the topic here. I think I addressed the main topic, which was informed consent, and why it's very difficult, if not impossible, for your medical provider to give you informed consent, because they're not given the full information of what's in a vaccine. I will be doing more of these, and maybe doing a whole lot more if the medical school told me to be very careful, and the way they worded it was not just be careful, but kind of as a threat of like, don't you dare say anything contrary, or it could be a problem for you getting residency down the line, moving forward. And I'm not trying to cut my chances off or burn any bridges in any way, but nothing I'm saying is that contrary, should be seem that problematic. I'm discussing health from a health perspective. There's different angles to it. It's a scientific discussion, meaning it's not one size fits all. We don't know all the answers, so it should be open to discussion. And as I mentioned before, I'm left in a position where I have to either trust the hierarchy, which doesn't provide me with good information, which the information they've provided seems to be riddled with holes, and the model they're suggesting is a pharmaceutical-based model, which means there is a conflict of interest happening here that's coming from the medical school, and I'm supposed to trust that, which I have no... Or I can trust the fantastic wisdom of the body, which again is like AT still. Go to the prairie. Or I can trust the fantastic founder of the institution who said that disease is easy to look for. Health is the challenge. Health is the thing to really try to look for. Anyone can find sickness or disease. If you want to create health, it's something you need to learn about, participate in. To that effect, now I'm getting to get on my little soapbox here. I am starting up my own little group again. I'm excited about that. As I said, the first step really in getting healthy is getting an inventory. What do you want to do? Where are you now? What's your biggest obstacle? Those type of questions. Getting an actual understanding of what you're at and how you actually going to get to where you're going. And then you develop a plan. And it's time to work that plan and until you succeed. So I will be setting up a group. I'll be getting you more information about that. Especially as it seems I'm going to be kind of putting myself... I'm jumping off the ledge, as it were, with this video. And I'm going to continue flying because I've got to create something else for myself. The medical school option, again, I'm going to complete it because I know I can. I wanted to tick that off and say I'm smart enough, obviously, to get through medical school. It's not a big deal. I want to be able to be respected in my critique of the medical profession, having actually gone through it and seen what it is and see if it's recoverable in any way. I think it's very much recoverable, but it's going to take a lot of people jumping off the ledge and trying to fly with the message of truth, because for some reason it's a very cloistered world, and it's so I'll have more time if that ends up not happening, but as it goes, I'm going to go through medical school and still keep providing this. I'm starting up a small concerted group of people who are going to be... I only have room for a little bit. I don't want to overload myself, but I just want a small group of people who are committed, willing to do the work, and we're going to get super healthy. Increase our energy levels, increase our vibrancy, and keep that model going. I appreciate all the questions. Thank you for the comments, and I'll do more of these, and you can ask questions at that point. Till then, family, live well. Continue. I gotta just my last little thing here. I know the world is a weird place right now, depending on where you are. It can seem weird. Please do your best to stay focused on the positive. There's enough negativity in the world already. It's not doing you any good anyways, so focus on the positive. There's enough people doing positive. There's always two sides of things. Focus on the positive for now, and I'll see you as soon as I can. Be well, family.